All right, I love this green screen effect. It's really cool to me. So, parents, I have a lot of times I'll get kids with one diagnosis or the other, and their parents are very surprised that the doctors are sending them in to get tested for the other thing. So, I might have somebody with autism who's coming in, and their parents are like, but they're testing them for ADHD. Or the opposite. Usually they have ADHD and now they're being tested for autism. And I usually will hold both my hands up and I'll explain to parents that so many of, what's on the checklist for ADHD is also on the checklist for autism. These two have a lot in common. When we look at kids who have just one or the other, they are very different. But it's just good for you to know that there's a very big overlap between the two. Sometimes symptoms of one disorder can look like the other one, and that's, not just these two. It could be other different disorders that can look like the other ones, or the effects of one are actually making the other one worse, or they're mimicking another behavior. But it's just good for people to understand, the ADHD, autism, very, very big overlap between the two. So don't be surprised if you're being tested to rule out one or the other when you already have a diagnosis of one of them. So like I always say, it's important to get a diagnosis, get a thorough diagnosis that's looking at all kinds of things at the same time, so you don't have to go back and test again for something else.